right. Good evening. Thank you for joining us for this webinar on penile prosthesis. My name is Dr. Mark Purdy. I'm a urologist from Vereniging, and I'm delighted to be joined this evening by Dr. Shah. Dr. Shah is a urologist from Atlanta, Georgia, in the United States. He has a special interest in men's health and has cured hundreds, if not thousands, of men with erectile dysfunction with the use of the penile prosthesis. Thank you, Dr. Shah, for being here.
Absolutely. No, it's a pleasure. Thank you for having me.
Just for the uninitiated, a penile prosthesis is a device placed during a surgical procedure into the middle of the penis for men with erectile dysfunction. It has literally been around for decades, but in my experience, not enough patients, even doctors, are aware of this treatment that is available. The purpose of this webinar is to discuss which patients should consider getting a penile prosthesis, to discuss some of the benefits and the risks, and what to expect after the procedure. And just as an additional short introduction, it's important to be aware that the penile prosthesis available is a malleable inflatable. Malleable meaning that the penis is always rigid but may be angled downwards for concealment. And inflatable, as the name suggests, a hydraulic device where the penis is usually in a flaccid state most of the time, but as a mechanism to increase its rigidity or an erection for intercourse, which is of course more natural. So Dr. Shah, just to kick things off, which men with erectile dysfunction would you say should consider getting a penile prosthesis?
Yeah, that's a good question. That's a very general question. When you talk about erectile dysfunction treatments, you have your medications, you have your injections, vacuum erection devices, and then you have your penile prosthesis, right? And then in some areas you can throw less reputed or less studied treatments. You can throw in more herbal medications that aren't well studied but are out there. You can throw in testosterone treatment if it's a hormonal imbalance. You can throw in your shockwave treatments and what we call like plasma-rich protein shots and stem cells, which are considered experimental by almost every major guideline out there. And so that's your bulk of treatment options. So the question is, all right, patients have all these options. How do you end up with a penile prosthesis, or how do you know you're a good candidate for it? And I think it's actually a fairly easy question to answer, right? For the most part, the patients that undergo penile prosthesis are patients that have failed at least one or more other options. Either those options were not available, too expensive, or don't work, right? I mean, that's basically it. The most common treatment is going to be the oral medications like sildenafil or tadalafil, right? Those are going to be the most common treatment options. Those are either not available, ineffective, right, or too expensive. So those are going to be, that's going to be the hallmark of the patient that comes to see you. Many of them have tried injections. It doesn't work. Patients that absolutely should get a penile implant, absolutely should, are men that have such severe erectile dysfunction that, no treatment works. So that's the obvious, but also men with priapisms. They've had an erection that lasts too long, and the guideline shows if you have had an erection that's lasted over 36 hours, there's no hope. Once that you go to the ER and someone brings that erection down, there's no hope of getting another erection again. At that point, you should just consider having an implant. You could even consider having an implant put in before it's even brought down, because the way it's brought down is oftentimes to sort of obliterate that channel where blood is sitting, right, the erectile bodies. And if you do that, you're going to get severe scarring and severe penile shortening. If we go ahead and put a penile implant at that time, then we can go ahead and negate that, preserve some of your length, and also make it so you can still have erections or an erection in the future. So just sort of keep that in mind. I think there's value to that. And that's actually one of the few things that is actually covered in South Africa for penile implants. So that's one of the few coverage points. So, I mean, even the government agrees that in that setting, it would make sense to move forward with the penile implant. So, I mean, I think that's the obvious, but also obviously patients that just other treatment options are ineffective. I think they're all great options for or candidates for penile implants. So.
Okay. And then maybe just link into that. So you mentioned someone who maybe has a prolonged priapism, and then you would maybe put in the malleable straight away. But how about in the elective setting? Is there anyone who you would say, this guy's better suited to have a malleable than an inflatable? Or is there any why you would want to actually have a malleable? Yeah.
Good. I mean, I think that's a great question. So obviously in an emergent setting, I think a malleable makes sense. I think if a patient had a complication with a previous surgery, or has an active infection and you want to do something, I think a malleable makes more sense because there are less moving parts, a lower risk of reinfection. So I think those settings are key.
Okay.
Outside of that, honestly, it's both just personal preference and then what's available from a cost perspective, right? There is a cost difference between a malleable and an inflatable. I think that's a big deal. The way I counsel patients, so when we talk about it, what I tell them, this is the way I describe it. I tell them, look, think of Toyotas and Lexuses. And the malleable is a Toyota. It's simple, it's durable, gets you from point A to point B and just gets the job done, right?
Yeah.
But it's simple. All right.
Mm-hmm.
The inflatable is a Lexus. It's the same family as a Toyota, right?
Yeah.
Except, and it can still durable, it's still reliable, still gets you from point A to point B. But the difference is that it has all the gadgets. You can inflate it, you can deflate it, right? You get a little bit more length, a little bit more girth, because we can be a little bit more aggressive in the sizing, given that it's not up all the time.
Yeah.
Right? So, and it's a little bit more rigid. So you get a little bit more, but you still get from point A to point B. It's still reliable, it's still durable, and it still gets the job done. The question is, are you a Toyota guy or are you a Lexus guy? And that's really the question that you have to ask, right? Because outside of that, for all intents and purposes, they both accomplish the same thing. They both give you a good erection, and they both let you have sex whenever you want. So.
Mm-hmm. So you mentioned penile size. So let's say someone has the inflatable penile prosthesis put in. Generally, compared to before and after, flaccid and erect, what sort of differences can one expect there?
Yeah. So one of the benefits of the inflatable is that because it's in the erectile body, it leaves the penis sort of pooched out. So patients that are so-called growers instead of showers, so guys that say, when my penis is flaccid, it's short, but when it's erect, it's long, or it was like that, right, before you had penile implant surgery, or before you had erectile dysfunction, I should say. Those patients are going to now all of a sudden become showers, right? All of a sudden, with an implant, even deflated, it's going to give you a little bit more flaccid length because it's going to leave you pooching out. And that's one of the benefits. That's one of the things most patients actually really like about the inflatable penile implant. Different from the bendable implant, the malleable implant, where you just always have an erection. So you only have one length, you only have one setting, and that's erect or semi-erect, right? There's no flaccid, there's no erect. There's just one. And so the beauty of the inflatable is you're going to be an outie per se instead of an innie. You're going to have you're going to have your penis sort of showing in a positive way, even when you're flaccid. Now, when you're erect, the other benefit of the inflatable device, and I do a lot of surgery with length and girth enhancement, and a lot of my patients come to see me because they're genuinely concerned that if they go to the wrong person, they're going to get shorted and they're going to end up losing length, right? It's a genuine concern. And so the beauty of the inflatable is you can be a little bit more aggressive in sizing because it's not up all the time. So, you can end up getting a little length. And then the inflatable implants work as tissue expanders. So as you inflate and deflate it regularly, it'll start stretching that space. So if in the future you need another implant, it's usually going to be, the measurements are going to be bigger and longer than they were previously. And some of the implants that we put in also increase in girth as you increase in length. So if you put a longer implant in, they actually are girthier or have more girth potential. And so that's also an added benefit to inflatable penile implants, depending on the type you use.
Yeah. I mean, but it can't all be risk-free. So someone going into this, what sort of risks commonly should they think about?
Yeah, I mean, I think that's a great question, right? With every good thing comes a possible bad thing, right? And so that's the beauty of surgery. There's no zero risk surgery. Even just removing a little scab off someone's hand can cause bleeding, right? And so, and that bleeding could reoccur if a scab rips off again later, right? So, I mean, there's no zero risk surgery. That being said, the risks of penile implants are pretty low and pretty reasonable. The infection rate is about 1%. If you have diabetes that's not as well controlled, then the infection rate goes up to 3 to 5%. But that's the case with any prosthetic. You get a hip replacement, knee replacement, there's that infection risk. That's the dreaded complication that most people worry about, right? So that means a 99% chance that you won't have that dreaded complication, right? If you move forward to surgery. Now, there's other potential risks. The implant can shift while you're healing. The pump can get moved too high, and maybe you need a revision surgery to move that down. The implant can, we call it a herniation, where the implant comes out, and sometimes you have to redo it. You can get shorted on size, or you could lose a little length sometimes, depending on the amount of scar tissue that's there, et cetera, right? That being said, a shorter erection is still better than no erection. And in general, those risks are low, and they're fixable and treatable, and you can always redo the implant if necessary. So, I mean, that's the beauty of it. I think overall it's actually a fairly low risk, but not a no risk surgery, and that is something important to understand.
Yeah, and once the individual goes through his operation and has it put in, how long until he's ready to start using it?
Great question. I would say, so one thing I always tell patients, talk to your surgeon and ask him. But for my patients personally, if they're not diabetic, around 3 weeks, we have them start inflating and deflating the implant. And a week after that, if they've got the hang of it, we say, hey, you're free to use it. So about a month. If they have diabetes, I oftentimes make them wait about a week or two later. So I say about 5 to 6 weeks if you have diabetes, 3 to 4 weeks if you don't have diabetes. But so on average, probably a month for most patients.
Okay, all right. And as a mechanical device, of course, there's going to be a bit of wear and tear, etc. with this. But on average, how long would the average person expect before they need some sort of replacement of parts, so to speak?
Yeah, great question. So with the malleable implant, the bendable rods, there's no true mechanism. So in theory, it could last forever, unless it somehow forces its way out of the body, which we call an erosion. Can happen. Oftentimes we let it heal and we put another one back in. With the inflatable, there is a mechanism to that, right? So it can break. The most common thing that's going to break is the tubing. The cylinders can also break, so lots of things can possibly break. The data actually shows 88% of these are still going strong at 10 years. So 10 years after surgery, 88% of patients that had an inflatable penile implant put in are still using that same inflatable penile implant. So, I mean, these things last a pretty long time, believe it or not. Even the warranty on it is usually something like 10 years for a lot of the companies. And so, they all understand that, hey, we hope that this thing lasts a long time. And we expect it to last a long time. Now, I've seen it break in a year. And what I tell patients is, look, if you used it so aggressively that you broke it in a year, more power to you. And that's great. You deserve a new implant, And so that, I think, like anything, a car, usually cars can last 5, 10, 15 years, but they may break in a year. Okay. Yeah. And if it breaks in a year, what are you going to do? You're going to replace it, right? Yeah. So this is no different. Just like our Toyotas and Lexuses.
Yeah. And just one last thing. So is it painful? Are these erections with this inflatable device, inflatable penile prosthesis, is it painful?
Yeah, that's a great question. And so normally if you have an erection, that lasts too long, it becomes painful, right? And
Okay.
so the thought is, okay, well, now you have a penile implant, so you always have an erection. It must be excruciating, which is not true. Remember, the erection mechanism is completely different. If you have an erection called a priapism that lasts too long, the reason it's becoming painful is because now the reason you have that erection is because you have a blood flow in there. And that blood flow is what's supplying the penis, right? And that blood flow is losing oxygen quickly. And as it loses oxygen, you're becoming what we call ischemic. That lack of blood flow and the lack of oxygen that can be supplying the penis is not there anymore. And that's the problem. In this case, it's a mechanism. It inflates and deflates with just normal saline, like a substance that's readily available in your body, right? Even if it leaked out, it wouldn't harm you. But it's a stretching mechanism instead. You still have blood flow around it, and you still have your other blood vessels. So this is not impeding blood flow. So because of the lack of impedance of blood flow, you're not gonna have pain. Now, initially, the first time you have this implant put in, you'll have some stretching pain, right? It's like the first time you exercise. All of a sudden, you're sore, your muscles are painful. But it's a good kind of soreness, right? It feels good, but it feels sore because you just exercised a muscle that you haven't exercised in years. This is no different. You're exercising a muscle that you literally haven't exercised in years. You're stretching the thing, and the first time you start stretching it, you're going to feel some soreness. You'll leave it up. If it's inflatable, you'll leave it up for maybe 10, 15 minutes, and you say, that's enough for me right now. It's kind of sore. Then the next time, you may leave it up 30 minutes, and then the soreness will kick in. And then the next time, you may leave it up in 45 minutes, and then eventually you'll get to an hour, and you're like, I feel fine, And that's how the penile implant works. It's just like the first time you lift, you lift the bar twice, and you're like, oh gosh, that hurts, I'm sore. And then the next time 3 times, then 5 times, then 10 times, and you're building that muscle memory, and you're doing fine. And then the next time you're doing 100 reps, then it's no problem. That's like this. You do 100 reps inflating and deflating this implant, you can have no problem.
Great. So I think that kind of wraps up this brief introduction to the topic. I'd just like to say for our patients who may be interested, they should contact their local urologist to discuss things further. And if they are unable to offer them the procedure, I'm sure they can refer them to a colleague who can. Dr. Shah, thank you once again for joining us this evening, and I hope to see you again soon.
Yes, thank you, Dr. Purdy. It was a pleasure. Thank you for having me.